Hi Garrett, my name's Kiana, and today I'm just going to check your cranial nerves, and I'm also going to check your reflexes. I'm going to perform hand hygiene. And we're going to start by checking your cranial nerve number 1, which is the olfactory. So can you close one nostril and sniff? All right, the next. Okay, so your nose is patterned bilaterally. Next, I'm going to have you close your eyes, close a nostril, tell me what the smell is.
Cinnamon.
Yes. I'm going to have you do that on the next nostril. Tell me what it is.
Lemon.
Yes, good job. So your cranial nerve number 1, the olfactory, is intact. Next, I'm going to have you come stand up. We're going to check your cranial nerve number 2, which is your optic. We're going to do the confrontation test. So you stand an arm length away. We're checking your peripheral vision. So close your eye. Tell me when you can see my finger.
Yeah. No. No. No.
Okay, the next.
No. 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 No.
Perfect. So your cranial nerve number 2, the optic, is intact. That's what I'm going to sit. Next, we're going to check the cranial nerves number 3, 4, and 6, the oculomotor, the trochlear, and the abducens. So first, I'm going to have you pull your eyes down. Okay, the conjunctiva is pink, your sclera is white, and your blood vessels are present. Next, I'm going to check your pupils. So your pupils are round and they are equal. They both measure at 5 millimeters. Next, I'm going to see if they're reactive to light. So just look at me. All right, your pupils are directly and concentrally reactive to light bilaterally. Next, I'm going to check accommodation. So I'm going to have you look at the door right there, and now look at my pen. All right, so your pupils constricted and your eyes converged. That's perfect. Next, we're going to do the cardinal fields of gaze. So I'm just going to have you follow your finger. Keep your head straight, just move your eyes. All right, so there's no nystagmus, so that's good. That means that your cranial nerves number 3, 4, and 6, the oculomotor, the trochlear, and the abducens are all intact. Next, we are going to check cranial nerve number 5, which is trigeminal. So for this one, I'm going to have you clench your teeth. You can close your mouth. Perfect. Your muscle is strong. Next, I'm going to take this. I'm going to have you close your eyes and touch a few spots on your head, your face. All right. Was it equally strong and equal on both sides? Perfect. So that means your cranial nerve number 5, the trigeminal, is intact. Next, we're doing your cranial nerve number 7, which is your facial. So for this one, I am going to just look at your face. Your face is symmetrical. Your eyebrows and your eyelids, your mouth, none of them are drooping. Next, I'm going to have you smile. Okay, I'm going to have you frown. Okay, I'm going to have you wrinkle your forehead and puff your cheeks. Perfect. Everything is equal, meaning your cranial nerve number 7, the facial, is intact. Next, we're going to do your cranial nerve number 8, which is the acoustic. So for this one, I'm just going to palpate the tragus. Any pain or tenderness?
No.
Pain or tenderness?
No.
The mastoid process.
No.
Pain or tenderness? Okay, perfect. I would assess, I would look into your ears and look at the tympanic membrane, look if it's pearly gray and white, or pearly gray and round, but for this, I'm not going to, for this assessment. Next, I am going to check your hearing. So I'm going to have you stand up. We're doing the whispered test. So I'm going to whisper 3 words and tell me what they are. You're going to close one ear. Basketball, volleyball, spaghetti.
Basketball, volleyball, spaghetti.
Okay, I'm going to have you take a step over.
Pillow, blanket, noodles.
Perfect. You got 3 out of 3, so you passed that test. Your cranial nerve number 8, the acoustic, is intact. Next, we are going to do cranial nerves number 9 and cranial nerve number 10, which is the glossopharyngeal and the vagus. So for this one, I would also assess by testing the Gregg reflex. I would stick a tongue blade to the back of the throat until they gag to check if that's intact. But for that, I'm not going to do it. But I'm going to just have you open your mouth and say ah. Say ah.
Ah.
Perfect. Your uvula was midline, it rose midline. So your cranial nerves number 9 and 10, the glossopharyngeal and the vagus, are both intact. Next, we're going to check for cranial nerve number 11, which is the spinal accessory. So I'm going to have you bring your shoulders up. Perfect. Turn your face. Perfect. So both of your muscles were strong and equal bilaterally. So your cranial nerve number 10, or cranial nerve number 11, the spinal accessory muscles are intact. Next, I am going to assess cranial nerve number 12, which is the hypoglossal. So I'm just gonna have you stick your tongue out. Perfect. Your tongue is midline, it's even, there's no deviations and there's no tremors. So cranial nerve number 12, the hypoglossal is intact. Next, I am going to check your reflexes. I'm going to do your patellar. Can you pull your hands up a little bit? So after that assessment, I can note that your cranial nerves number 1 through 12 are intact. For this, I'm just going to have you relax. I'm going to hit right under the kneecap. Perfect. Perfect. So both bilaterally, your patellar reflex is a 2+. Now I'm going to have you come and put one leg up on here. So this one, I'm checking your Achilles reflex. Can you move up a little bit? There you go. Okay. Perfect. Now the next one. Okay, both your Achilles is also a 2+ for the reflex. That concludes the cranial nerve and your reflex assessment. Thank you.